Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Louie. He's almost exactly a 1-year-old intact male Pomeranian. You can see he looks pretty sad and depressed. Poor Louie was hit by a car and he's in real trouble. He has a very, very severe problem. Louie has a fractured coccygeal vertebrae in his tail and a syndrome known as Cauda Equina Syndrome. And here, if you look at the vertebrae of his tail, you can see a giant gap where there's space where there's supposed to be vertebrae. This is a very severe set of problems that looked completely hopeless. Louie had no use of either of his hind legs. He had no voluntary control of his urinary bladder. He had no use of his tail, which just hung limp, big bushy tail, covered with fetid diarrhea, as he had no anal tone. He could not control his anal sphincter at all. He was completely forlorn, and again, the situation looked totally hopeless. After visiting with a neurologist from Iowa State University, we decided to give Louie a chance, and so we treated him with our spinal cord injury protocol, which includes intravenous treatment, oral medication, some Western pharmacopoeia, some herbal, acupuncture, and therapeutic laser treatments. After a few days, we decided to repair the fracture in his coccygeal vertebrae and to remove his tail. Nerves have some elasticity. They will stretch before they break. So in this case, when the vertebrae is fractured and it pulled the nerves from the sacrum backward toward the tip of the tail, when the nerves eventually snapped, then they bounce forward like a rubber band that broke in two and roll back up inside. So even though the injury is behind its caudal toward the tip of the tail, it's behind where the spinal cord ends, yet the clinical signs are forward from that injury because of those nerves being snapped back forward. So we've drilled a hole in the dorsal spines of the coccygeal vertebrae on either side of that fracture, placed a cerclage wire through those holes, and now we're tightening that wire, which is reducing that fracture and closing that gigantic gap. This orthopedic repair does nothing to repair the nerves that are damaged. There you can see the cerclage wire, our finished product, everything lined up, and we've amputated this giant bushy tail, so it's much more manageable now. And Louie stood up on his own. So he isn't standing because of this orthopedic surgery. He's standing because of the other treatment, the acupuncture, the intravenous and oral medication, the therapeutic laser treatment, physical therapy. That is what's causing his spinal cord to be able to compensate for this terrific level of damage. When Louie came in, it seemed extremely unlikely that he would ever walk again, that he could live through this at all, that he would ever regain use of his urinary bladder. And here he is, running around. He can urinate voluntarily. He's standing on his hind legs. He's got a good attitude. He's a tough little guy, and he's doing amazingly well. He has certainly beat the odds. Reducing that fracture and fixing it has certainly helped to control the pain, and it's realigned a more normal anatomic alignment. But it's not the reason that he's walking. He's walking because of the other treatment, the acupuncture, therapeutic laser, physical therapy, and the other medication, and certainly by the grace of God. Everyone in the hospital is pretty excited about Louie's miraculous recovery. Here, Dr. Ann takes him up front to visit our receptionists so they can share in this case and in this miraculous outcome. This case seemed so completely hopeless. It seemed very little reason to allow Louie to even live through it. Euthanasia seemed the kinder path, but after talking to the neurologist at Iowa State, we gave Louie a chance. We treated him. We put our hearts into it. God smiled on us. But here we had a setback. That tail stub that you saw before eventually died back after a week or so, and so it had to be amputated even shorter. This was a concern because we had to remove that tail so short, so close to the sacrum, because it was necrotic and there was no other choice, that we were afraid that he may lose control of that anal sphincter and maybe have damage beyond that. And yet, it's worked out perfectly well. We took off the tail and he's running around just fine and just making an absolutely amazing recovery. So, other than the inability to wag his tail, which no longer exists, he has no deficits whatsoever, and he goes on to live a happy, normal life, being a dog, soaking up the sun, running and playing. Louie, you're an amazing story. And Louie has come back to see us. It's been almost exactly 2 years since he was in a very unfortunate and severe accident causing a fracture of a coccygeal vertebrae, meaning a vertebrae in his tail, resulting in Cauda Equina Syndrome. To say his tail was dragging is not just an expression. Louie had a very large, bushy plume of a tail that was just dragging on the ground behind him. He could not use his hind legs, nor his urinary bladder, nor his anal sphincter because of the damage to his sacral nerves from the vertebral fracture. Originally, we thought that Louie's chances for survival were practically zero, but we did end up amputating his tail and did a lot of work with Louie, and that was 2 years ago, and look at him now. It's a distant memory. Louie, you're the reason we come to work in the morning. Columbus Small Animal Hospital, loving our work.